Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about some of the top reasons why you might want to delay knee replacement surgery and some of the top reasons why you may want to go ahead and get a surgery now. Before I jump into that, be sure to hit the subscribe button, turn on the notifications so you can catch all of our videos related to knee replacement surgery. So first, I definitely want to say that this is going to be an individualized answer for each person. Have that conversation with your physician, with your surgeon, with your family, and come to the best answer for you personally. But here are just a list of some different things you want to consider. So first, looking at why you may want to delay surgery. So if you are someone who is a little bit younger, so in your 40s and your 50s maybe, or even younger than that, you may want to consider delaying. So knee replacements have a lifespan, an average amount of longevity typically, where at some point they'll start to break down, loosen, or just fail in general. And in this case, then you'll need a revision knee replacement surgery. And a revision surgery tends to be more complex and difficult than your traditional normal knee replacement. The surgeon will have to go in, remove the prosthetic. They'll have to remove and resurface bone, so you have to have adequate bone stock to perform this surgery. And it just tends to be not quite as good a recovery. So many people still do have good recoveries and have good quality of life after a revision surgery, but it's just not quite as high percentages. People tend to have a little more stiffness, pain, and just issues in general after a revision surgery. So if we can avoid the risk of a revision surgery by delaying surgery till you're a little bit older, this is definitely something worth considering. Another thing to consider is your pain and symptoms. How intense and how significant and frequent is your pain, your swelling, your stiffness, and any other symptoms you may be having? And are these significant enough to warrant a knee replacement? You may determine that they aren't significant enough or frequent enough that you want to go ahead and get surgery right away. You may be able to manage your symptoms through conservative treatment options, physical therapy, physical activity, and exercise, and you may want to avoid having a surgery right away if you're able to tolerate and manage these symptoms conservatively. Something else to think about is major life events. So you may have retirement coming up, a big wedding in the family, travel, whatever that may be. And you may want to consider that, do I want to be going through the rehab and recovery from a knee replacement or the preparation for a knee replacement if I know these things are coming up on my schedule in my life? So it may be a matter of delaying for a number of months or a year or so until getting through those certain big life events. Another thing to consider is, have you tried conservative treatment options? So have you tried activity modification, physical activity, exercise strategies, and have an exercise plan or program? Have you tried physical therapy, injections, cortisone, the gel, the viscosupplementation? Have you tried these less invasive, lower risk of complication strategies before going to our last resort of a knee replacement? Knee replacement, of course, carries risks. There's risks of complications with surgery, and not everyone, unfortunately, has a great outcome. Most people do, but not everyone. So if we can avoid knee replacement and have that as our last resort, that's a much more reasonable and prudent plan. And you may be someone who is a little bit more high risk of having a complication. That may be because of obesity. It may be because of diabetes with poorly controlled blood sugars. It may be because you're a smoker. You may have cardiovascular risk factors and history. You may have had a blood clot previously. So some of these things, of course, we can't control, we can't change necessarily, but some of them we can control. So we could possibly work on getting down to a little bit healthier body weight. We can work on controlling your diabetes and your blood sugar, stopping smoking. And so this, again, a discussion with your physician, with your surgeon. Can we delay surgery, try to get some of these risk factors under control a little bit more, and just reduce your risk of a complication when you do have a knee replacement surgery? And then one other thing I like to consider is if you're someone who is in the older category, so I would consider that for this video, someone in your 80s or 90s or older, is going through the preparation, the surgery itself, and the recovery and the rehab after surgery, plus having that risk of complications with surgery, potential risks. Is it worth going through all of that for the benefits that it would provide in terms of mobility, in terms of quality of life, in terms of pain and symptom management? For some people, it may not be worth going through all of that at the older stage of life in your 80s or 90s. For some people, it may be worth that, but that's just something to consider. And then just switching over and looking why you may want to not avoid or may want to not delay surgery. So first of all, you may be in that sweet spot for age. You're in your late 50s, 60s, 70s. You're at this age where you can tolerate the rehab and the recovery. You have relatively good mobility, relatively good physical status, decent range of motion in your knee, and you can tolerate and get through the knee replacement process with relative ease and efficiency. I wouldn't say ease, that's probably not the best word, but relatively efficiently compared to being a little bit older and having some more issues. So you may want to do that while you're at this age, while you're in this sweet spot, and then you can really get the most you possibly can out of your knee replacement in terms of increased mobility, activity tolerance, quality of life. So you may be at that sweet spot where, I may not necessarily need it right now. My symptoms aren't super intense, but I know that this arthritis is progressing. I'm starting to have a little more difficulty with things. I'm in this kind of sweet spot with age. So let's go ahead and get the knee replacement now. A little bit lower risk of having a complication, more efficient recovery, hopefully, and really get the most bang for your buck, the most out of your new knee, and improved quality of life and mobility, hopefully. So that's a really good reason why you may want to consider not delaying surgery. You also want to think about, I've gone through the conservative treatment options. I've gone through therapy. I've gone through injections, exercise, and it's not working. I'm still having pain and symptoms and issues. So that's another reason you may say, okay, it's time for surgery. And the other thing is, of course, looking at your symptoms is really the main factor. How intense is my pain, my stiffness, my range of motion? How frequent is it? And is it impacting my quality of life enough that it needs to be addressed? And I'm willing to go through this invasive procedure that does carry some risk with it. It's well managed through surgeons and the medical team, but there are some risks involved with any surgery. But is it going to help improve my quality of life, my activity tolerance enough that I'm willing to go through this process? So I hope this helped answer this question for you. Please, again, if you don't subscribe already, hit that subscribe button and turn on the notifications. Of course, leave your comments and questions below. And of course, please hit that like button to spread this video to other viewers. Thank you very much for watching.